Thanks, Lascia and Corla. And just before I start, I'd like to signal that I will be discussing a range of mental health topics, including suicide. And Lascia and Corla, thank you for including this issue for today's topicals. International Men's Day is on Friday, giving us a chance to reflect on issues relating to men and boys. Mental health is one of these issues. While it is an incredibly significant matter which affects everyone, a focus on men's mental health is important this week. The majority of people who end their life in Ireland are male, being as high as 80% in some years. As of September, 437 people are recorded by the CSO of dying by suicide in 2018. 327 were men, that's 75%, and 110 were women. These figures and comparable ones for previous years demonstrate the need for a strong strategy to address male suicide. The situation is more nuanced, as we know that the rate among middle-aged men aged 40 to 59 years old has been the highest of all age cohorts. Research has shown that economic recession and increased rates of unemployment are associated with a decline in mental health and increased rates of suicide and self-harm, not only in Ireland but across the world. Compounding this are larger gender issues such as reticence to seek help, higher rates of alcohol and substance misuse, and belonging to an at-risk group such as men who are gay, transgender, travellers, victims of domestic abuse, migrants, former prisoners, and rurally isolated. The state response must acknowledge these complexities and work to address not only mental health, but also the larger societal conditions that exacerbate them and increase suffering. Minister, I appreciate that Minister Butler is committed to improving our mental health services, but she can only work with what the department are given. Mental health reform points out that our national mental health budget represents only 5.1% of the total health budget, when the World Health Organization recommends 12% and Sláinte Care represents 10%. This deficit is being felt with insufficient staff to meet current needs. When it comes to taking mental health seriously, campaigns and champions are so important, but specialist healthcare will always do the heavy lifting. We need more therapists in the community, psychologists, psychiatrists, nurses, social workers, occupational therapists, and peer support workers in all HSE regions. The waiting list for child and adolescent mental health services, CAMHS, also needs to be addressed. The absolute importance of early intervention can't be overstated, and yet we have over 2,000 children and young people on CAMHS waiting lists. I've been working with families across Cork South West in getting help for their child, and I know most, if not all, other TDs are doing the same. Another matter, Minister, that I have repeatedly raised is the lack of eating disorder treatment services. Tomorrow evening, RTE have a programme about men who live with an eating disorder, which is underreported and isn't spoken about enough. Minister, no funding was allocated under the National Eating Disorder Treatment Plan for 2020, and of the 1.6 million allocated in 2019, not 1 cent of it was spent. Minister Butler is committed to making change in this area, but we have to acknowledge that people are still not getting the treatment they need, as demonstrated recently by a young Cork woman who had to fundraise to get the care that she needs for an inpatient bed. There are only 3 inpatient beds in the entire country. All of those beds are in Dublin, and we know that eating disorders are the mental health condition most associated with mortality. The government's Sharing the Vision mental health strategy launched earlier this year will remain another hollow HSE document unless it is supported with the necessary funding. Medical and healthcare professionals and advocacy groups have repeatedly pointed out what is required to provide the proper mental health care for boys and men, all who need it.
Thank you, Lascia and Corla, and thank you to Deputy Kearns for raising what is such an important issue. It's men's mental health, particularly in the context of suicide, and particularly given the fact that this Friday is International Men's Health Day. Firstly, I think it's important to say that a loss of life to suicide is a tragedy, and my deepest condolences go out to any family or any individual who has lost someone to suicide or has been affected by suicide. As you've rightly pointed out, it's a very complex problem, it's a very complex situation that individuals and families find themselves in, and it means that they need support in many different ways, and as you've outlined, this is not just about the Department of Health, it's about so many other departments coming together to try and tackle this issue. International Men's Health Day, as I've said, is this Friday. It is an opportunity for us to not just consider men's mental health, but to look at what is being done and what more can be done to try and support men. In doing so, we need to acknowledge, and you have rightly so, Deputy, acknowledged that most deaths by suicide are among men. This is an international phenomenon in this respect, and Ireland is no different, unfortunately. This was highlighted in a joint report by the Men's Health Forum in Ireland and the HSE National Office for Suicide Prevention back in 2018. The report notes that men are more likely to die by suicide than women, and the highest suicide rate is among those aged 45 to 54, but as you've pointed out, it's extremely high from 40 to 59 as well. The report explored the specific mental health and well-being needs of those who are at risk, those who are most vulnerable in middle-aged men. It noted the stigma attached to mental health, a stigma that unfortunately still exists, even though I feel we've made huge strides in talking about it and exploring this issue and in providing support and help. But it exists, and it has been highlighted still, unfortunately, as a significant issue and a significant barrier to seeking help. Middle-aged men are identified as a priority group in Connecting for Life. This is the national strategy to reduce suicide, and this continues to work with and to support the Men's Mental Health Forum in Ireland to try and implement a number of the recommendations that are included in this strategy. Men's Health Week is held in June each year. Many of the activities highlight and promote positive mental health and well-being, and they are all supported by the HSE and by the Department of Health. The HSE also supports men's sheds. These are, I think, a great social network for men. They're a social contact and vital of positive mental health. But of course, not every person or every man is involved or goes to their local men's shed. But for those who do, I think it is a vital support and something that this government very much supports. We are all determined to reduce the incidence of suicide in Ireland. Last November, we published and extended the Connecting for Life by 4 years, and that's bringing it up to 2024. Implementation of the strategy involves a cross-departmental approach, acknowledging the significant complexities here. A cross-sectoral approach. It's overseen, of course, by the Department of Health, and the HSE National Office for Suicide Prevention was specifically established to coordinate suicide reduction efforts across the country and to implement Connecting for Life. So there's a lot of strategies, I appreciate that, but there are all of these elements are connected. It's all been driven by the Department of Health. It's in connection with the other various departments. And since 2010, the funding specifically for Connecting for Life has increased from 3.7 million to the current level of 13 million. A key part of Connecting for Life is the development of the local Connecting for Life plans, and this is plans that have been developed within local communities. It's a collaborative effort between the HSE, the local services, community groups, organisations, individuals who have been impacted by suicide, who want to help, who want to play their part, and really they're designed to reinforce the whole suite of supports that are available, to look at follow-up care, again to tackle stigma in the local community and to support those who are bereaved by suicide as well. We have to always remember that it's not just the individual, but there are many others who are impacted by this as well. More broadly, and I'll come back to this, I appreciate my time is up, the overall funding, I know that we're not where we need to be in that regard, and I think we all appreciate that, but we are now at a point where 1.149 billion is being allocated. That has increased significantly in the last 10 years, and the only way that that is going to go is continue to increase, because we appreciate that more needs to be spent on this issue. Thank you.
Thank you so much for your response, Minister, and yeah, that is welcome, and I suppose I'd encourage you to push for the adequate resources and services to be allocated and for them to be spent. In response to my parliamentary question, I learned that the non-spend of the 1.6 million allocated to the Eating Disorder Treatment Plan in 2019 was because the HSE and department officials assigned it elsewhere. And I suppose when we have those allocations, like you say, that are so welcome, this just can't be allowed to happen again, that it's reallocated. Services and groups that help address the larger societal issues are important too. The state's response to domestic violence, so the Istanbul Convention standards is 1 refuge space per 10,000 people, but Ireland provides 1 space per 10,000 women, leaving us with 50% less capacity, and I think ignoring men in that. There's very little infrastructure for men, and this structural deficit, I think, really does compound the stigma for male victims and survivors of domestic violence. Like you said, and I totally agree with you, the Men's Shed movement has made, I think, an incredible impact in addressing isolation among men, especially older cohorts. And any support the government give to local sheds does have a manifold impact in terms of mental health. Rural transport schemes, something else I wanted to mention, they're important factors in helping people socialise, and there should be more and later running buses to provide these connections. Also, in terms of independent supported living and social housing available for mental health disabilities, in a lot of areas they just aren't available, and it's particularly hard for single men to get social housing. Finally, it's essential that we have more conversations, I think, to challenge the stigma around mental health and to help people get the help that they need. It's especially important for boys and men to talk with their family, classmates, teammates, friends, colleagues, whoever it might be. So if you do anything for International Men's Day, have that conversation. And just briefly, Lasky and Corla, when discussing these issues, it's important to note that the Samaritans are available 24 hours a day for those that need a confidential, non-judgment, support-free phone, 116123. And the helpline for Bodywise, the Eating Disorder Association of Ireland, is 012107906. Thank you.
Minister, to conclude.
Thank you. Thank you, Deputy. And, I think you've really highlighted the two most important things here that I would agree with you and support you wholeheartedly on. Firstly, this is about each and every one of us looking after our own mental health. I visited my own father's grave last night, actually, for the first time in a while, and it's almost 9 years since he died by suicide. And I suppose when if I visit the grave, I always think about my own mental health, that of the people who are around me. And it's so important that we continue to look out for ourselves, but that we continue to look out for each other, that we allow a space where people can talk about it, where they feel that they can come forward, where they can talk to each other, particularly those in their family, their close circle, their community, their friends. And I think most importantly, when people do decide to take that step forward, that the support is there for them, that it's there when they need it, that it's there in the way in which they need it. And I appreciate particularly some of the issues that you've highlighted that we still have to make a lot of progress on. I am fully determined, and I do believe that this government, particularly in the increase in funding and the development of the HSE services, the specialist services, the various different programmes, but some of the areas you've mentioned around eating disorders, I think there is still a huge stigma, not just for boys but girls, but in particular men. There's a particular problem there, and I'm concerned where you're saying funding hasn't been spent, and that's something that I will raise directly back with the Minister around domestic violence. This is an issue that I'm particularly focused on and determined to address in my own role as Minister for Justice. And again, there is a stigma there when it comes to men who are victims of domestic violence, and that's something that I'm trying to address as part of the Supporting Victims journey, but also other areas that don't come under health: rural transport, isolation, people being on their own, feeling that they don't have anyone to turn to or that they're not connected to anyone. And that's, again, going back to Connecting for Life. It's about looking at all of the departments. Where can we actually join up all of the dots? Where can we make sure people have these supports? And when they do come forward, that they are there for them. So thank you for raising this important issue. There's a number of things that you've specifically raised that I'll bring back directly to the Minister. Thank you.